Penny Kufis carried out her husband's end-of-life wishes to the letter. A Nazi concentration camp survivor, Lewis witnessed suffering firsthand and did not want to linger after being diagnosed with bladder cancer.
What was important to me was that his wishes be respected.
Mike Nugent also had that often difficult conversation with his parents and knew their end-of-life wishes as well.
They both made it very clear that they wouldn't want to be sustained artificially if there wasn't any hope of them returning to some kind of wholeness.
Penny and Mike now counsel others on preparing advance directives like living wills or a healthcare power of attorney.
Having some of these additional resources to ensure that you get the type of care you want can be very important for people.
People who want or feel more comfortable with less aggressive care at the end of life, their advance directives in regions of the country where the care was more aggressive seem to have a bigger impact on care.
Doctors Lauren Hirsch-Nicholas and Kenneth Langa from the University of Michigan and co-authors studied data from 3,300 participants in the National Health and Retirement Study who died between 1998 and 2007. Those data were linked to Medicare records, which identified treatments patients received and the total spent on their care.
In the most expensive regions, Medicare spending was modestly lower for patients who had prepared an advance directive.
The study appears in this week's JAMA, Journal of the American Medical Association.
In most parts of the country, patients who had a living will were more likely to receive hospice care and less likely to die in the hospital.
In areas where medical care is less aggressive, it may not be as important to have these kinds of advance directives if you're interested in less aggressive care.
Both Penny and Mike remain passionate about having advance directives.
Where I had to make decisions for Mom, I felt very comfortable knowing I was doing what she wanted to do.
We have this one life, and only the person who is dying has the right to decide how to end it. I tell people that in my counseling, that this is your decision, your life.
Catherine Dolf, the JAMA Report.